All
right, we are gonna get started. So for those of you watching on YouTube, this is the exam 2 review. It's a little longer, so once I get to question 5, I'll scroll down so you can look at the rest of the questions. So we're just gonna jump in, get started, just kind of go through this together. Actually, I'm gonna grab my book. I'm also gonna talk about like the things that you should know. You guys can hear it. Like things that I would recommend studying like on your workbook. So I will try to mention those as well as we go through. So starting off with deciduous anatomy, I would recommend making sure you know like which ones look like the maxillary. So go back, make sure you understand overall the differences between sorry, I meant permanent, not maxillary when I said that earlier. So make sure you know which deciduous teeth resemble which permanent. Make sure you understand the general characteristic differences between the permanent and deciduous. And that was covered a little bit earlier for exam 1. So go back and read through that material, just refresh yourself on that because there will be like tooth anatomy questions about the deciduous teeth. And then there also may be some like comparative, how are permanent and deciduous different. So that gets us to number 1. Which of the following is true about the mandibular deciduous first molar? So does anything, when you guys read mandibular deciduous first molar, does anything pop out in your brain?
This might be so wrong because it might be an inconsistency, but I know one of the molars is actually, hold on. The molar of the deciduous tooth, like the second molar, is bigger than the first molar of the permanent or something like that. That's what pops in my head, but it might be bad.
That's not exactly what I'm looking for. It's a good comparison, but mandibular deciduous first molar, that's one that doesn't resemble any other tooth. That's the odd one out. So that's what I was getting at with that question. Sorry, that was kind of vague. But so for that, immediately, that kind of like rules out some things, but we'll just go through the correct answers. So for this one, number 2 is correct. The tooth has no buccal groove between the mesiobuccal and distobuccal cusp. So basically what that's saying is instead of like a super pronounced groove between those two buccal cusps, there's more of a depression in between them, and that's unique to that tooth. And then number 4 is also correct. The crown appears to lean lingually. Honestly, is like a general, like as a generalization, most of the teeth that are, most of the posterior teeth do appear to lean lingually. So that's just like a good thing to know generally, is a lot of those crowns, especially for the deciduous teeth, lean lingually. And then the other one that's correct is 5, which is the mesiobuccal angle is prominent because of the cervical ridge on the mesial side. So remember the whole like cervical ridge, go back and review that. It's a bigger thing for the deciduous teeth that's not really mentioned for the permanent. So the correct answer for that is D. Oh, sorry, C. 2, 4, and 5 are correct. All right, number 2. Assume all third molars are gone and excluded from classification. How would you classify a patient's dentition if they're missing tooth numbers 3, 4, and 5? Not quite. Also, this is a really good reminder for this exam. Go back and make sure you have your tooth numbering systems down for both the permanent and deciduous teeth, because that will pop up.
I have a question about that. But I can write it out, but do you think in the exam would you just, the last exam, I just wrote them out so that I could just look? We'll have plenty of time to do that. I still struggle. I don't know right off the top of my head.
Yeah, that's fine. I think I'm pretty sure for all my exams, I wrote them out.
Okay, you have plenty of time.
Yeah. From what I remember, yeah.
Like think about it. Pretty hard. It's something to watch.
Do you have an answer, Sarah? 2. Yeah, it is 2. So the way I do this is 1, I do like this finger trick. 1 is bilateral, so both sides. That's 1 posterior to the teeth. 2 is on one side, posterior. 3, I like to like pretend like there's a tooth in between my fingers. On one side, that's 3. And then 4 would be like, I do this for 4, like someone got hit with a hockey puck and all their teeth are gone. So it's just a little like trick to remember which class is which. And that will probably be on the exam. So I would study that page and be able to like match it. Okay, number 3, which bridge choice is used without prepping the crowns of the abutment teeth? So you guys, do you know what the abutment teeth are?
Like the two that the things attached to, right?
Yeah, the tooth that the bridge, fuses to, yeah.
It's a Maryland bridge, right?
Yeah, so the Maryland bridge is the one that you don't have to drill the abutment teeth at all. You can just fuse it on. Okay, does anyone know how long sealants last up to?
10 years.
Yes, up to 10 years, and I'm gonna go through. So this is kind of the area of the workbook where there's a ton of like fact sheet articles, and there's also a lot of tables, like the indirect restorative dental materials. I would like read through those, highlight what you think is important, because some of these questions, like he'll pull questions that are like important concepts from these like little fact sheets that are in the workbook. So you don't have to study every single sentence, just read through it. If there's like a number of like months for like something or years for something, that's probably important, so highlight that. And then just general things that you think stick out, just highlight it, make sure that you refresh yourself on the articles, because he does pull things from there. All right, number 5, destruction of gingival fibers and periodontal ligaments describes which disease?
Periodontal disease.
Not quite the answer I'm looking for. Yes, it's B, it's gingivitis. So this is a little like, you have to notice the distinction. So periodontitis, which is option A, that is when there's an unhealthy amount of bone reduction and like a super inflamed periodontal pocket. Gingivitis is just like general destruction of the fibers and the ligaments, but nothing to do with bone. And then periodontal disease is just kind of the umbrella term for all of that. So I would know the differences between periodontitis and gingivitis, and then just know, I think he says periodontal disease may occur if there's no daily removal of plaque. So I would use those definitions. I think, let me try to find the page. There is a specific page that talks about this. Let me try to find it. Page 137, that says the plaque story. There's the general definitions there. So I would just familiarize myself with that. Okay. So we're gonna scroll down on Zoom. I'm also gonna scroll down so you guys can see it too. Okay, so number 6, this is another like memorization matching question. Does anybody know which tooth prep or crown prep this is? If you don't, that's okay. This is page 144, and it's the full bevel. I would do like, on my iPad, I just like whited out I took a picture of it, or I took the PDF off of Canvas. I did like white out on the like labels, and I would just go in and like write it in. So I would quiz yourself on that, because those are the really easy points on this exam. Same with number 7. I try to find the page this is on too. Does anyone know what number 4 on the figure represents? And this is page 152.
Wait. Yeah, I want to say 8.
No.
Hold on, is it pointing to like the?
So it's pointing
So it looks like it's on top of the two, but I
to
feel
like
like
this thing.
that's in between.
It's really hard to see, and he doesn't explain this a ton in the lecture. So this literally was on my exam. You guys, I opened the book. I was like looking before my exam. I was like, no, this is gonna be on it. So I didn't look at it, and then it was. So I would like, this is just pure memorization. Go through and try to memorize like the big words for each one of these, because there's a good chance that it's on your exam, and it's just an easy point. Yeah,
What page was it? Sorry, I didn't.
it's page 152. So basically, I think what this is saying is it just stabilizes the entire, like this stabilizes the whole class. It's kind of like in the middle between like the lingual, what do they call it, like the lingual bar and then the backside. So in general, this area just like stabilizes the entire class. I think that's what he's getting at for this, if that makes sense. So memorize that. All right. Do you guys have questions on that or no? Okay. Okay, let's see. We're to number 8. From which germ layer does the enamel organ develop? So this is from the ectoderm. This is kind of easy to miss in the lecture or in the workbook. If you go to page 157, I know we're doing like a ton of flipping, but page 157 under enamel organ development, it says the enamel organ is the ectodermal development. And then for number 9, if you, I'm going so fast. Are you guys keeping up with me? Okay. For number 9, where it talks about the dentin and pulp organ development, that's on page 162. And it's right under the bolded dentin/pulp organ development. So when I had the hardest time like finding this last year when we did this review, because I had no idea where it was, but it's right under like the headers for these sections. All right. And then just to like kind of review the content after like labeling all the diagrams, which is a lot of like memorization for embryology, I made a flow chart like of all the stages of development. So if you guys want that, I can send it to you. I think for me, like flow charts work a lot better, like timelines, and that helped me study a lot. And that's what I did for like basically all of the embryonic development. So if you want that, like text or email me and I'll send it to you. But page 155, where it has like the photos of what each stage of the development is, that will probably be on the exam. I remember that being on my exam. So the same thing as like the crown preps that I was talking about. I like have this on my iPad, or you can like print it out and just kind of like black out the labeling and try to like label it on your own. And that's helpful for memorization. Okay, so I'm gonna scroll down. Yeah, so you're gonna see anything I stuck today.
Wait, we skipped 9, but was 9 endoderm?
9 was mesoderm. Yeah. 9, sorry, I went through that quickly. 9 was mesoderm.
Right, I forgot my book, so that's.
Oh no, you're good. Yeah. Okay, so the next few questions that we go through are the questions that I had, or are like the content that I put in my flow chart when I was studying last year. So a lot of this is just like understanding. Don't try to memorize facts, try to understand the whole story. I think memorization, I was trying to memorize it at first, and that made it a lot harder. If you can do a flow chart and understand like the story and kind of visualize it in your head, I think that's a lot more helpful than trying to memorize facts for the embryology section. So that's what I would recommend for studying this. But does anyone know when the ameloblasts stop making enamel?
Do polarity change?
Not polarity change, that's something else. This is actually, so that's the polarity change is when they become like pre-ameloblasts to ameloblasts. So that's like before they lay down the enamel. But for number 9, they reach the outer enamel epithelium, and that's when they stop. So that was like for the story, the polarity change was like the beginning of like laying down the enamel, and then reaching the outer enamel epithelium is like the end of the laying down the enamel. Okay, number 11. The epithelial attachment is secreted by which structure, and what is the function of it? Are you guys ready? Just giving you time to write everything.
Wait, sorry, are you talking about the? It's the outer.
You're on the right track. So this is like following the story that we were just talking about. The ameloblasts reach the outer enamel epithelium. So that would be like the edge of the enamel for your tooth. Does that make sense to everyone? So, okay, yeah. So if you like visualize it, this is like where you'd see like the incisal edge of your tooth. This is where like on every surface, the enamel is done being laid out. It's basically the surface that's like touching the environment. That's how I think about it. So it reaches the outer enamel epithelium, then the ameloblasts and the outer enamel epithelium like kind of fuse together to form one layer, and that's the reduced enamel epithelium. And that is what secretes the epithelial attachment. And so like now in your head in the story, you have the reduced enamel epithelium. This is on the outside of the tooth. And so what does it do? It secretes a glue-like substance to hold the gingiva to the tooth, which makes sense, right? Because we have like the outside of our tooth, we want the gingiva to stick to it. So that's kind of the end of the enamel development story. Is that making sense? It's a lot of like vocab.
I feel like the B, right? I feel like sorry, that I was talking to myself, but on page 160, that's kind of like a story. Is that kind of where you talk about like it talks about the polarity change?
Yeah,
And talks about the neuroblast. There's like drawing that story out. Is that what you recommend?
yeah, that's what I did. It's just I don't know. It's so hard to like visualize. It's so hard to like memorize too. I feel like when you're trying to memorize facts and you don't understand like the full story, it's harder to like recall.
Yeah.
So that's why I'm trying to like explain it as a story. So yeah, the 160, like your own flow chart, that's helpful. The flow chart that I made like ties everything together. So it has the enamel development and like the pulp and dentin development. So mine is like super big, but that's like helped me. So yeah. Okay. All right, so now we're on to number 12. Describe the 2 stages of calcification.
There's mineralization and maturation.
Yeah, what happens in them?
Mineralization, all of the crystals have been laid down and will not increase.
Mhm.
And then the second stage maturation is they become intact.
Yeah, exactly. And this is the enamel. So this is during enamel development, just to clarify. All right, number 13, during which stage do the nerves and blood vessels develop in the dentin/pulp organ? So now we were just talking about enamel, right? And enamel is kind of the surface of your tooth that you see in the environment. Now we're talking about the dentin and pulp organ, and this is like developing kind of more inwards toward the center of the tooth. So it follows the same type of story, but different things happen. So does anyone know when the blood vessels and nerves develop? Yes, it is.
Okay.
Yeah, so I'm on page 162 in the lecture manual in the workbook, and most like big things happen in the cap stage of the enamel organ. So like in the cap stage of development, that is when like the most things happen for the dentin and pulp organ development. Does that make sense? Which you can see in the lecture manual because there's like way more events that occur. So if you're ever in doubt, usually things happen in the cap stage for the dentin and pulp organ development. Number 14, which filling material is more sensitive to thermal changes? No. This is kind of funny because it's almost like
That's
Don't-
like so counterintuitive.
don't overthink it. Yeah, well, what is amalgam? It's like a metal.
Oh, well, yeah. Okay.
So metals conduct heat, right? So the answer is A. Yeah, you see what I mean? This is kind of common sense, but this one, sorry, I didn't mean it like that. This one, if you think about it, it makes sense. This is page, we're like flipping around a lot, but just to kind of orient yourself on what we're talking about, this question is coming from page 145 slash, let me find the other one, 134. So page 134 and 145 talk about, those are like these big charts for everyone on Zoom. It's these pages, and they talk about the differences between the materials for like fillings and caps. So he likes to ask questions on that. It's like a lot of info, but if you have time to like look it over, it could be on the exam. All right, 15, which fiber group functions to protect the blood and nerve supplies and resist twisting? Any guesses? I'll give you a hint. The blood and nerve supplies come in from the apex of the tooth, the apical foramen. Do you say it?
Yeah.
D, yeah, it is D. Yeah, this one's kind of a good giveaway. When it says blood and nerve supplies, that comes out of the apical foramen at the like very tip of the root of the tooth. So this one, in my opinion, is pretty easy because there's only one apical group. So that's how I memorize this one. Contrary to like the development embryology, which was a lot of storytelling, this is a lot more just like memorization. And I think Dustin probably talked about that in his review. Okay, 16, which fiber group functions to attach the gingiva?
So I don't want to say.
Which one?
B.
No. So it's E. So this one, so there's the way that you split up like the fibers is bone to bone, which should be like the root of your tooth to like the bone that surrounds your tooth, the maxilla or the mandible, or bone to tissue. So bone, like your tooth to the gingiva. And so number 15 was about bone to bone. And then number 16, or sorry, yeah. And number 16 was about the bone to the gingiva. And so for this one, it functions to attach the gingiva alveolo-gingival group. And then there's also dento-gingival group. That one isn't right because that one supports the gingiva. So remember, attach a alveolo and then gingival for gingiva. Does that help for like memorization? Okay, that's how I try to do those tricks at the end. It's a lot of content for this class. All right, 17, last one. Which type of bone is a cribriform plate made of? It's alveolar bone, C. And let me find this in the lecture because it's a little confusing. So, okay. Just to orient everybody here and on YouTube, I'm looking at page 191 in the workbook. The cribriform plate. Oh my gosh, you know what? I'm so sorry. You're right. I did the wrong one. I'm glad we checked this. It's the spongy bone. Is that what you said, B? Yeah, that's right. Sorry. I'm glad I went back and checked. It's spongy bone. This is where I got confused, but can also be referred to as the alveolar bone proper. So the type of bone, it's spongy, but it can also be called alveolar bone proper. Does that make sense? Okay. All right, let me know if you have any questions or if you want like my super long flow chart.
So,
Mhm.
do you have to remember the last part of the lecture today? Like it mentioned
Oh.
about the statistics of,
Wait, let me look, make sure. Was that after the
yeah, actually.
deciduous? I'm pretty, no,
No?
none of this stuff.
What was it?
So the dental demographics, which is this for everyone on Zoom, you don't need to memorize this. So no worries about that. All right, and then, yeah, just email or text me if you guys have any questions or want any like study materials.